Hi, my name is Lauren Tansky, and I'm the Senior Research Program Coordinator at the Center for Population Health IT, CPHIT.
What does the Center for Population Health IT do?
Well, our bread and butter is really using digital health data from claims, insurance claims, and the electronic health record to create predictive modeling algorithms to help produce the best outcomes for everyone.
How do you support the mission of HPM through your job?
I think one of the main ways I support the mission is helping to manage the research and development pipeline for the ACG software system. It's a population health analytics software platform that can be used to manage risk and predict utilization and help with outcomes in better health and less cost.
Nice. What motivates you to come to work?
I think my family, my daughter, and the community that I live in and work with every day, I think that it helps to be hopeful. And at HPM, we can use history, maybe even recent history, to help create things that are better for everyone.
What are you passionate about?
I'm passionate about helping underserved communities and people that may be kind of unseen and deserving of the health and care that we all are.
What impact do you hope to have?
I hope that just in my management of my day-to-day work and supporting of the faculty here, I can help kind of create that ripple effect that, maybe one policy, one change, or even helping just one person live in a way that feels better. That's the goal.
What is one current project you're working on?
One current project that's really interesting to me right now that I'm working on is a project through the Alacrity Center. And I'm working with a small team here at CPHIT on it. And it's about people with serious mental illness and how their social determinants of health and their environment where they may live may impact how they use services, like use the emergency department, kind of trying to find those trends and where you can kind of slip in and step in to kind of create better care coordination.
Can you give me an overview of what your career path has looked like thus far?
Yes, I graduated from Penn State with a bachelor's in rehabilitation services, and I worked with people with disabilities for a little while, and I ended up going into specialized case management, psychiatric outpatient case management here at Hopkins Hospital. And I really loved that. I loved working with the people, but I think it kind of put a magnifying glass on how confusing and complex, but at the end of the day, they're trying, healthcare system can be. So it was interesting when I decided to shift to the more research side. I kind of wanted like a peek behind the curtain. And it's funny because I spent so much time in the electronic health record in the EHR when I was doing case management, and it kind of came full circle when I came to CPHIT, and we now use that data to try and help people. A few years ago, I graduated with my Master's of Applied Sciences through the School of Public Health in Population Health Management, and that was really enriching for me.
What were your research interests while you were getting your master's?
Systems management, social determinants of health. I'm really interested in kind of like the whole environment, the whole person. We're not, in a bubble. Everything that touches us and everything we touch can impact our health and wellness. So that's what I'm interested in.
When you're not working, what do you like to do to decompress?
I love watching sports, go Eagles, as you can see by my mug. I like spending time with friends and family. I love working out, reading, watching TV, watching reality TV. Prestige reality TV.
Is there a particular reality TV show that's like your favorite?
I love Real Housewives. Okay, anything Bravo. It's an absolute gem on this earth. I love it. I'm also really into traders right now. I'm on the bandwagon. It's so fun.
Nice. What do your parents think of your career path?
I think they're really proud of me. They were really excited when I got a job at Bloomberg. I think that the reputation precedes it. and deservedly so. And I think they're just really proud. You know, they live in Pennsylvania, so I feel like the reputation of Johns Hopkins and especially of Bloomberg itself is really far reaching. So to them, they were like super proud, and I think that they love to see how far I've come.
Do you have any book recommendations or TV show recommendations?
Well, I did just talk about my TV shows, but I think we should all read Wuthering Heights right now. I'm gonna read it. I'm gonna download it when I get home today, and let's get into the zeitgeist.